This video will be talking about some ethical issues in working with spiritually integrated couple therapy. And I want to start with a case. So I want you to imagine that you have a case that's come in to see you. They're a young couple, and they've been referred by their pastor. And what's happened in this case is that the wife in the relationship became unhappy in the relationship, and she started to talk to this one friend of hers. And her friend said, you know, they have this marriage retreat at our church. You should really come to it. The couple had really not attended church hardly ever. They're kind of an Easter, Christmas kind of couple. And so the wife thought, well, yeah, this sounds good. And it was free and it was looking really good. Her husband didn't really want to go. He didn't understand why this was important. He wasn't really that unhappy in the relationship. He thought things were not great, but they were okay. And so she decided to just attend by herself. So she goes to this retreat and she takes lots of copious notes. And in her mind, she spends the whole weekend thinking about how her husband needs to improve their relationship, right? It's a common problem. So her friend says, you just should talk to our pastor. So she goes and she talks to the pastor, and the pastor says, you know, it does sound like you have some problems. Would you want to do some marriage counseling? And I know a great marriage counselor in the community. And so the wife says, yes, that sounds perfect. We should totally do that. And so she goes to her husband and she says, we need to go to marriage counseling. You need to come with me. And he still kind of doesn't really understand why she's so unhappy, but, you know, he loves her and he's not opposed. Counseling's a good idea. And so he goes with her and they sit down in your office now, right? So here they are. She is newly interested in religion. She started to go to church like every week now. Her friend has convinced her this is a good idea. He's not that interested. He's a pretty good guy. He's more interested in fishing on the weekend, so that's what he does on Sunday mornings. He goes out with a group of friends and they're out fishing, and they go to the bar on Friday night together. He's not an alcoholic. He's not over drinking. He's not having infidelity or anything, but he's just not really interested in religion. He's not opposed to it. His grandma was a religious person, but here they are. They're in your office. What kind of ethical issues might we face with a couple like this? It's a very common couple. They don't even have high red flag issues. How would we handle them? So one of the first things to be thinking about when working with a couple like this is whether or not the couple is the client, the wife is the client, or who is the client, right? So an important ethical issue to address in all couples counseling from the beginning is who the client is. Is it even possible maybe the church is the client? So if you're a church-based counselor, you might be working for the church and you'd need to clarify to the couple that your obligation is to the church. If you're working for the wife and she's actually the client, that's one thing. If you're working on the couple relationship, that's something totally separate. So you'll want to do that right up front. You might even consider putting that in your paperwork so that there's a place to kind of write in who the client is, because that can change who has access to the file, how you are going to bill, how you're going to deal with insurance, all of these kinds of implications that I'm sure you're all aware of. So you want to think about that up front and have that conversation with them right up front. This is sometimes a difficult conversation because couples don't come in thinking, oh, I really want to have an ethics conversation right up front, right? They come in thinking, I'm in pain, things aren't the way I want them to be, and I'm not even quite sure why I'm here, but she seems to be in pain, so okay, I'm here. They don't really want to have an ethics conversation, but it's important to have right in the first session to be able to address ethical issues and prevent problems that can come down the line when people are surprised that your goals and their goals aren't lining up. So one of the things that's also important is to be consistent with whoever the payer is or the insurance company. So if the church referred them, if the church is helping to pay for it, and it's for couples counseling, then just being clear across the board. If the insurance is paying for it and they won't pay for couples counseling, as is often the case, then is the wife the client? And does she have symptoms? Does she have a psychopathology for treatment? So you want to be clear and obvious in your documentation and your paperwork that you are doing what you say you're going to do. One of the things that can happen with this kind of couple too is that they'll try to get you to take sides. And I mean, don't they all try to get us to take their side? So part of our goal in doing couples work is to try to improve the relationship. And if we take sides, and we take sides for any reason, then we can actually hurt the relationship, right? And the outcomes of relationship counseling are worse when the therapist takes sides. So one of the things that needs to happen is for us to check ourselves and to think a little bit about, who am I going to naturally gravitate towards? Am I going to gravitate towards the wife because she's interested in spirituality and religion, and I'm a therapist who does spiritually integrated couples therapy, so am I going to feel like I, side with her more easily and think this is a good idea for them to become more spiritually aware and involved in their lives and take her side? That could actually end up being a problem in their relationship. Or am I going to take a side with him and feel like she's kind of overbearing and she's, forcing him to do things, and he's just kind of a nice guy, and I feel for him, and I'm going to feel like I'm going to take his side. So it's really important, of course, in all couples therapy to do an ethical, good job. But this can become even more important when spirituality and faith come into play, because he might think you're going to take his side if the pastor referred them to you. So you have to do a good job at communicating to both of them that, spirituality is a good thing, but they're going to express it their own way, and they're on their own journey and their own path for that, and that you don't have a stake in them changing their faith or in doing anything particular for their faith, that your job is to help them with their relationship and to make it more healthy. So that's the typical agreement. Sometimes if you're in a religious setting, you also do have spiritual goals for them. And if you do, you just need to be really clear with them about that and let them make decisions with a clear, informed consent right from the beginning. Confidentiality is also important. So with any couple, you want to be upfront, of course, right up front about confidentiality between the partners and have a clear kind of approach to it. So whether you're going to say, I don't keep secrets, or I only keep secrets if safety is an issue. I know that's my own personal approach. Other people say that they will keep things in individual sessions private between partners if they meet with them individually, and that they're able to do that and keep things separated. So you just want to be clear up front about that. But with spiritual issues, this can become even more important because you sometimes have another party. In this case, we have a pastor who referred them. And if you're a smart outpatient therapist, you're going to want to have some communication back to that pastor, thanking him or her for the referral. So how do you do that in a way that protects confidentiality and that lets things know? I know in my own practice, we have kind of a standard letter that we send out that just sends the same information no matter who the couple is, that just says, thank you for the referral. This is the kind of couple therapy that I generally do. So glad that you sent them to us, and then clarifies that any further communication would require a release of information. Even that letter does require a release of information, but it's a very safe thing, and the couple will continue to usually feel safe if you communicate something very standard like that back to their pastor. And sometimes you might want to get their pastor involved more. Their pastor might be a resource. It might be a person who can really help them and can do things that we as therapists can't do in their lives. And so if you do that, you just want to be really clear all along the way at every stage, exactly what's being communicated, how it's being communicated, maybe even have a joint meeting with everybody or the pastor on the phone with the couple there. So there's no questions about what's being communicated back to the pastor. Another ethical issue is competency. So we want to make sure that we as therapists are competent when it comes to religious issues. I know I've had couples come in sometimes from esoteric religious groups, and I've had to go and learn about them and learn more about that group. I've had the couple teach me about their own particular local group and their own view on their faith and how they see it. But it's also my responsibility to learn something about their religious group and their spiritual traditions so that I can respect that and I can, be in keeping with their understanding of the world around them. And finally, you might have dual relationships. So if you do work regularly with a pastor or within a church setting, you can sometimes end up with a dual relationship between the church community and your role as their therapist. And so we want to be really thoughtful and clear. In fact, most of the time when we get involved in dual relationships, we want to consult. The answer to everything in ethics, of course, is to consult with a supervisor or with a peer, and make sure that we're doing what's best for the patient, best for their relationship, if that's the patient, best for the partner, if one partner is the patient, and making sure we're clear and we communicate everything that we understand that's going on between them, and what our obligations are ethically, legally, as they go through the process of engaging in couples counseling. You want to also, I think, if they are an attender in your own church, you have a special obligation for a dual relationship there. So if you see people that attend your own church, to think about how you feel about that. Might you end up taking sides, say, with that couple I started with her, if that's your church, and you might want him to come to your church because you like your church and you feel positively about your church. And you can end up in an ethical bind there by encouraging something with the husband that may or may not be his goal, and may or may not be something that he needs at this point in his journey, in his life, and how they go. And even on a spiritual side of it, letting them discern as a couple where it is that they should be going, not necessarily you decide as a therapist what church they should go to or how they should practice their faith at home. So that's what I have to say about ethics today. And the next one, I will be talking a little bit about assessment and how you assess the religious or spiritual issues in a couple. Thank you.